Did you know that ADHD can look different in women, especially the inattentive type, and leading to a shocking rate of being underdiagnosed? So let's dive into the world of adult inattentive ADHD in women. Historically, ADHD research and diagnosis have centered around boys, predominantly featuring the hyperactive impulsive symptoms. So picture a 10-year-old boy squirming in his seat, getting up and down, blurting out answers in class, or regularly forgetting to turn in his assignments. So this gender bias in studies has led to a significant underdiagnosis of ADHD in girls and women. Girls are less likely to exhibit the hyperactive behaviors typically associated with ADHD, often displaying inattentive symptoms that can be more subtle and easily overlooked. As Dr. Hallowell, a renowned ADHD expert, highlights, this inattention often manifests differently in females, frequently misinterpreted as a personality trait rather than symptoms of ADHD. So the girls might have been seen as flighty, in la la land, messy, or forgetful. By the way, my name is Katie Sloan. I've been a licensed therapist for 20 years, and it would mean a lot to me if you would hit subscribe and like this video or leave a comment. This oversight of symptoms in young girls continues into adulthood, where many women with undiagnosed ADHD face challenges without understanding the root cause. Dr. Hallowell points out that this inattentive type of ADHD in women can lead to specific struggles, often overlooked or misattributed to other causes. It can sometimes be misdiagnosed as anxiety or depression. Also, keep in mind that ADHD has nothing to do with intelligence, and many women with ADHD are very successful, but just underneath the success, there can be a big mess. Here are 5 common symptoms of inattentive ADHD in adult women. Number 1, difficulty sustaining attention. Women with inattentive ADHD often find it hard to stay focused on tasks, especially if the tasks are not engaging or stimulating. So these are women who maybe start washing the dishes, but then get distracted by getting a notification on their phone, or maybe they suddenly remember that they forgot to return an email. So they go to do that instead. Then after days of ignoring the dishes or getting distracted while doing the dishes, there's a massive pileup of dirty dishes on the counter and in the sink, which then becomes an overwhelming task to have to try to complete. So it's also difficult to sustain any other task that isn't stimulating, such as writing a paper, reading a book, or even just having a boring conversation. Like, have you ever been talking to somebody and start to notice that they really aren't listening to you anymore? Maybe they just sort of zone out. Well, maybe that's ADHD. Number 2, disorganization and forgetfulness. So do you find yourself leaving coffee mugs all over the house or in your car, or maybe losing your phone or your keys really often? Maybe even leaving your purse in some public place and it gets stolen? Like, I'll be honest, I have to raise my hand to all of these things. So struggling with organization and frequently forgetting appointments or obligations is a hallmark of inattentive ADHD in adult women. And as women get older and have more responsibilities and possibly have other people, small people, to be responsible for, it can get worse and worse. This is because ADHD is a neurodevelopmental disorder that affects the prefrontal cortex. This is a key region of the brain responsible for executive functions, including memory, attention, and decision making. In individuals with ADHD, the prefrontal cortex often shows reduced activity and impaired communication with other brain areas. And this dysfunction particularly affects short-term memory, as the prefrontal cortex plays a crucial role in retaining and processing recent information. So consequently, those with ADHD may struggle to remember recent events or information, such as remembering somebody's name when they just told you their name, or forgetting to write down that doctor's appointment, then missing the appointment. Number 3, procrastination. Delaying tasks not due to laziness, but due to a difficulty in starting and maintaining focus, is very common. So many women with ADHD, including me, will put off tasks until the last minute, and it's only having that deadline that causes the motivation to kick in. I'm that person who will wait to pack for a trip until the day of the trip because it's only the deadline of having to catch the plane that gets me motivated to pack. And we know why this happens. It's potentially because of a dopamine deficiency in the brain or an issue with the way the brain processes dopamine or other neurotransmitters, which causes a severe lack of motivation to get started in engaging in an activity which won't provide any dopamine. I mean, it's pretty boring to pack, right, for a trip? At least it is for me. And dopamine plays a critical role in motivation, reward processing, and attention. Many of my female clients who have ADHD can relate to waiting until the last minute to pack for a trip or turn in a paper or study for a test or pay the bills, fill out paperwork or forms, buy groceries, get taxes completed, make appointments, and on and on and on. And it's only by having a deadline or a severe consequence that they're able to get motivated to get it done. Number 4, low self-esteem. Chronic struggles with attention and organization can lead to feelings of inadequacy and low self-esteem. You can imagine how life can be very frustrating living with these traits that I've been discussing here. It does lead to women feeling terrible about themselves. The behaviors that I've been identifying are often labeled in our society as irresponsible, lazy, messy, or immature. And over time, women can chronically struggle with dealing with these labels and feel not good enough, although they are trying really, really hard to hold it together and not really knowing what's wrong. You might ask yourself, why do these simple things seem so much harder for me to do? Number 5, overwhelm in multitasking. Feeling overwhelmed when trying to manage multiple tasks simultaneously is typical, contrary to the societal expectation that women should excel in multitasking. The ADHD brain can be viewed like an orchestra without a conductor. There's no one there to direct where the attention should go. So if there's 3 different tasks to complete, maybe within an hour, it can be really hard to figure out which one is a priority. All of the tasks seem equally important to the ADHD brain. Understanding these symptoms is crucial for proper diagnosis and support. Keep in mind that every person has some of these traits sometimes, and that is not ADHD. A person with ADHD has a combination of several of these traits, and it greatly interferes with their life on multiple levels. Also, ADHD can look different for each person. Dr. Hallowell emphasizes the need for increased awareness and tailored approaches in identifying and treating ADHD in women, especially the inattentive type. This knowledge not only aids in diagnosis, but also empowers women to seek appropriate help and strategies for managing their ADHD. There are many options for getting treatment, not just medication. There are ADHD coaches who can teach simple tips for managing life with these symptoms. If these symptoms sound familiar to you, you might want to find somebody who specializes in ADHD in women because it's still often overlooked by mainstream medical professionals. If you want to know more about ADHD in women, please leave a comment and let me know what you'd like to know. Thank you for watching, and I will see you next time.